Hi, I'm Kendall and this is Carrie and this is Crib Notes. Our topic for today is going to be all about choosing your provider. It's an important one and it's a difficult one to do. So Carrie, how did you choose?
Well, so I wasn't a labor and delivery nurse at the time. I was a nurse, but I was working in a totally different department. And basically, I just talked to this girl that was pregnant that I worked with and asked her who she saw, and she recommended him, and I went to him. It was kind of a, just an easy pick, I guess. But it turned out that the hospital that he delivered at was 45 minutes from my house, so it got a little tricky. Looking back, I wish I would have been more educated and probably made a better choice. So hopefully this video will help you guys look at all the things that you need to think about when you're choosing a provider.
More than just about, is it a male or female? I mean, that's an important decision in your decision making, but it's more than just that. There's lots of other factors that you should take into consideration when you're choosing a provider.
So there's different medical professionals deliver babies. Probably most of you are familiar with most of these options. There's a midwife, there's a family practice doctors that do deliveries. Not all family practice doctors do deliveries, but some do. And then there's obstetricians, or OB doctors as we kind of call them. Midwives only deliver babies. They are typically RNs that have gone on and gotten a master's degree in midwifery, and they tend to be more natural and more unmedicated deliveries, I guess I would say. They tend to, sometimes they deliver in the home, sometimes depending on the state that you live in, there's lots of different laws and stuff around that, but they just tend to look at birth as a natural process and something that the female body can do without a lot of medical intervention. That being said, we have 3 midwives at our hospital, and they do hospital births. They offer their patients epidurals, they use Pitocin, they do use medical intervention if that is necessary or what the patient wants. So just because you want an epidural doesn't mean you can't go to a midwife. You still can go to a midwife. The awesome thing about midwives is in the clinic, they tend to spend more time with you. They really, kind of care about your pregnancy and
definitely. I mean, they all care about your pregnancy, of course, but midwives tend to be a little more hands-on than the average provider.
Yeah, hands-on is a really good way to put it. Definitely more hands-on, kind of more available. I guess they tend to, like I said, they spend more time with you, they take less of a patient load, and so they just kind of have that time to offer. The other option is family practice. So family practice doctors are great. Before you're even pregnant, a lot of us have a family practice doctor that we maybe see, and some family practice doctors do obstetrics and then newborn care as well. So you can keep seeing the family practice doctor that you go to. They can do your pregnancy, all your prenatal visits, your labor, your delivery, and then they just jump right into taking care of your newborn as well, and still of you postpartum. So that's really a convenient way. They tend not to be as popular, and some of them don't do as many deliveries. So that's something you kind of want to think about too.
Right. You probably don't necessarily want to go to a provider that doesn't do very many deliveries throughout the year. You want someone that's seasoned and very knowledgeable about and up to date on the new techniques and research that's out there to keep you and your baby safe. Now, both of those providers that Carrie just mentioned, the midwife and the family practice, they don't usually tend to be the surgeon. Midwives for sure, never the surgeon for a cesarean section. They often assist the surgeon. And then also the family practice doctors, sometimes they can be the primary deliverer for a C-section, but most often they are not. So in the event that you go to one of those providers and you do need to have a C-section, there may be another provider that will step in that will go ahead and do the C-section for your provider.
Yeah, that's a really good point, Kendall. That's something to think about too. So those 2 providers, midwife, family practice doctor, they can't do everything. like an obstetrician would do, which is kind of the third role that we're going to talk about.
Yeah, so the obstetrician, you also will hear OBGYN. They can do the whole process. So they can do your pregnancy, prenatal care, your vaginal deliveries, your C-sections, and oftentimes those are the people that if you're needing for a vaginal delivery, you're needing, we call it
assisted delivery.
Assisted delivery, sorry.
So like forceps or vacuum.
Forceps or vacuum, yes. That would need to be, it's likely that would need to be an obstetrician that comes in.
Yeah, so think of them kind of as like the experts of baby deliveries.
Right, that's their forte. And granted, every state might be a little bit different, every hospital might be a little bit different on what exactly they allow each provider to do, but in our experience, that's kind of been the case.
Yeah, kind of general guidelines. So that being said, you kind of have your midwives, which are registered nurses that have gone on and gotten more training in delivering babies. You have your family practice doctors, which are kind of the next level. They are a medical doctor, with all of those, responsibilities and privileges, but they're not surgeons. And then you have your obstetricians that kind of cover everything. So something you want to think about, questions you want to ask your provider is, the first one probably is, where do you do your deliveries? I wish I would have asked that question, right? Because now I'm with this doctor that delivers 45 minutes from my house, which isn't great when you're thinking about going into labor and needing to get to the hospital. So where do you do your deliveries? Most, OB providers, obstetric providers, even midwives, only deliver at one hospital, because it's really hard to bounce around. So that's something you want to ask. If there's a specific hospital that you really would prefer to deliver at because it's close to you, someone that works there, whatever the case may be, you want to ask that question.
Another big question is you may go to the same provider through the whole pregnancy, but when it comes time to have your delivery, is that doctor going to be, or that midwife going to be the one that's going to come in and deliver your baby? In some situations that might not be the case. So knowing that in advance, is your doctor part of a large practice? Is your midwife part of a large practice where they tend to have the model of you see everyone in that office, and then that way when you have a delivery, you've
met everyone.
You've met everyone, and you're able to that provider that's on call for that day can step in and do your delivery. There are, however, some providers that will, special is a name, or that do that delivery for all their patients. That's not as common, I don't feel like, anymore.
So that just means that the provider that you see in the clinic at your prenatal visits is going to be the one that delivers your baby.
Yeah.
And that's unfortunately not
as
super common anymore. I will say with family practice, that is the case. That's a perk of family practice.
It is. But you don't, as someone that's doing, a large amount of deliveries every month, you don't necessarily, I don't know if I personally would want to go to someone that does all those deliveries. You want someone that's well rested, has that work-life balance, because all that's important. Their life outside of the office is super important in creating the type of doctor they are in the office and in that delivery room.
So even though your OB that you've seen in the clinic isn't going to come in and do your delivery, this is kind of something that surprises women a lot of times. Really, the nurses kind of run the labor. Your OB doctor is not in the room with you during your labor really at all. They come in and check on you, usually in the morning before their clinic hours, sometimes at lunch, and then when it's go time, like when your baby's crowning. So the nurses really run the show during the labor. So even though it feels like it might be a big deal that your doctor that you've seen in clinic isn't going to be the one that delivers you, typically for most people, it's not the end of the world like they sometimes see.
Right.
So, another one of the questions that you really should ask and make sure you're on the same page with your provider is if you have really specific requests. So if you're somebody that absolutely does not want an elective induction, or you want a primary elective C-section, you should check, have that conversation with the provider that you're kind of interviewing. because they might not be on board with that or okay with that. And some obstetricians really love inductions and they want to do those. And if that's something that's not going to jive with you, then you're probably not a good match.
Right, and it's okay to go to that first appointment and meet this provider and decide, is that, it's kind of like a friendship. You decide, is this someone that I want to, you know, I feel like it's going to be a good match for our big day, then great. If not, it's totally acceptable to check out a couple other providers.
Yeah, move on sooner rather than later.
Right.
For sure.
Doing late transfer of care, you know, it's can make it a little bit more complicated, and frankly, you know, doing it a whole bunch of times or late in pregnancy can be a little bit on the dangerous side. We just want to keep, you know, you guys all safe.
Yep. And you'll find that providers, some of them are more touchy-feely, some of them are kind of just to the point,
very
and
medical.
direct and medical, and some people like that. Some people need the hugs and the reassurance. So
yep,
you got to pick what's right for you. But those are some things to think about.
Yeah, if you have any questions, you know, write those questions in the comment section. Please subscribe to
subscribe to our videos.
Yes, crib notes.
Yes, we will do more the more subscribers we get.
All right, thank you.